are new concerns about a rise in coronavirus cases as states continue to reopen. Some 14 states across the country, including California, Texas, and Florida, reporting case increases of 25% or more in just the past week. Joining us now, Michael Osterholm, Director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Doctor, when you look at all the states with a 25% increase in cases in the last week, what do you see going on? Is it just some isolated spikes? Is it a new second wave? What do you see happening?
Well, first of all, it's important to put this into context. And Daniel Bornstein, the former librarian to Congress, once said, "The greatest obstacle to discovering the shape of the earth, the continents, and the oceans was not knowledge, but in fact the illusion of knowledge." And I think that what we have here today is we're not sure what's happening. We have 22 states where we have cases increasing, 8 where it's level, and 21 states where it's decreasing. And I think that what we're really talking about here now is what does reopening do? What did the protests do? And we just have to be humble and say we're in an unsure moment right now what's happening in this country.
Now, some people, Doctor, have suggested that the reason we're seeing more cases is because we're doing more testing, but it isn't just new cases. I want to put some numbers up on the screen. 5 states have seen at least a 35% increase in hospitalization since Memorial Day. And the CDC projects that deaths will jump from 115,000 now to between 124 and 140,000 by July 4th. How much of this do you attribute to states reopening and people easing up on social distancing? And do you think when you see this increase in hospitalizations and deaths that some states should consider pulling back on reopening?
Well, what we have to understand is that about 5% of the U.S. population has been infected to date with this virus, some locations slightly higher. This virus is not going to rest until it gets to about 60 or 70%. When I say rest, I mean just slow down. So one way or another, we're going to see a lot of additional cases out there. The question we're asking ourselves right now, what does reopening do? What did the protests do? And I can give you examples where in some states like Arizona, the percentage of tests positive are going up substantially, suggesting it's not just a testing artifact, as you pointed out. Hospitalizations are going up. That surely is an indication. But it's not universally across the country. And we're at one of those moments right now where we have to understand what is actually happening. How much is the virus driving itself? Remember in previous influenza pandemics, we saw waves. These were 2 to 3 months of cases that then would suddenly just literally almost disappear, go into a trough, which had nothing to do with a man-made activity, only to come back with a vengeance in a second wave several months later. So we're really at an inflection point right now of understanding. Do we think reopening is going to increase cases? It sure should. But we have examples of states where it hasn't. So I think this is where, again, we have to be very humble and say this is a very serious challenge, but we don't really know what is actually making the virus move like it is right now in some states and not in others.
Well, you're speaking as a scientist, and I understand that. That's what you are. But if a governor were to come to you and say, hey, I've had this steep increase in cases, hospitalizations, what would you tell them to do? You can't sit there and wait forever for all the data.
I would absolutely agree with you. We have to continue to stay on top of this. The question is, can we go back down into what was total lockdowns? And this is the point that we don't have a national plan for understanding what we're trying to do here. Should we go back into lockdowns if we see these substantial increase in cases, particularly if we're beginning to overwhelm our healthcare systems we're seeing in some areas? But then if you're in a state where the cases have been dropping precipitously for the last month, they're going to ask, well, what are we supposed to do here? And that's the challenge that we have right now. So in a state where cases are increasing, and since they are in some states substantially increasing, they've got to respond to that. But this also points out in those other states, we've got to figure out how are we going to let society move forward without closing things down.
You have talked, Doctor, a couple of times about the protests, and this is something we're going to see because of the 2-week incubation period. We're going to see in probably the next week or two. How worried are you about all these mass protests that we saw for 2 or 3 weeks across the country? Thousands of people in the street, many of them without masks. How worried are you that they are going to spread the disease?
Well, we are very concerned about this, but we also, again, have to be honest that it's one of those areas we just don't know. These were outdoor protests. We know that the outdoor air more rapidly dissipates the virus. The chances of being exposed are much less. On the other hand, yelling, screaming, being exposed to tear gas or smoke, which causes coughing, being put into a holding cell overnight in a jail if you were arrested, all are reasons why you would expect to see more cases. As I sit here this morning, we've looked for data around the country outside of some isolated examples of National Guard members in the D.C. area or the state of Nebraska. We've not yet seen evidence that this is increasing. We surely have not yet seen it here in Minnesota. But as you pointed out, Chris, this next week to 2 weeks are going to be the telling time. We just don't know.
All right, let me ask you another crystal ball question. What's your best estimate? Because policymakers and all of us as citizens, because we sort of have a vote in how we proceed, what's your best guess is what we're going to see over the next 6 months as we head into the fall? Are we going to see isolated spikes? Are we going to see a big second wave? Are we going to see a steady downturn? I mean, as you sit here today, what's your best guesstimate?
Well, first of all, remember, we're not driving this tiger, we're riding it. We are going to go from 5% of the population infected with all the pain, suffering, death, and economic disruption that's occurred to date. Trust me, we have a long ways to go to get to that 60 or 70% of people infected with some protection with immunity as a result of that infection, or we get a vaccine in time. How we're going to get there is still unclear. My biggest concern is if cases would start to disappear across the country, suggesting we're into a trough, meaning a true wave change. We may have several months of few cases. That would suggest it could be like influenza and come back with a very, very significant second wave late in the fall. We may continue to see what we're seeing right now, where it hits some states, doesn't hit others, goes back and forth. We don't know. But the important thing is we are not planning for the fact that we are going to see a very substantial part of our country become infected over the next 12 to 18 months if we don't have a vaccine. We will never be blue and red again. We will be COVID colored. And that's the message the public has to understand. And they can do something about that by distancing, by staying out of large crowd locations. That's a hard message to hear, but that's what we need to get across right now.
Well, you led me to my last question. Large crowd locations. President Trump has a big rally planned for this weekend, Saturday. As we know, he attracts big crowds. There'll be thousands of people in a closed arena. No requirement that they wear masks. And in addition, we now hear the president in late August is going to hold his acceptance speech for the Republican nomination in a closed convention in Jacksonville. Thousands of people coming from around the country to there and then going back to their respective states. Forget the politics. As a matter of public health, do both of those concern you?
Anything that involves large crowds indoors where there is also screaming, yelling, loud voices, cheering, all which will help aerosolize this virus, I think are real challenges. Let me just put it very simply. Would I want my loved ones in a setting like that? Absolutely not. And it wouldn't matter about politics, reason why they were there. I wouldn't want them there. And I think that this, again, is part of the sense we're not understanding. We have a long ways to go with this pandemic. It is not over in the next several weeks.
Dr. Osterholm, thank you. Thanks for joining us today. Please come back, sir. Up next, we'll bring in our Sunday